All right, so if you missed the introduction earlier, my name is Michael Zabrodski. I'm a veterinarian, and I'm currently in the second year of a 3-year program here at the University of Saskatchewan, where half of my time I spend training for veterinary anatomic pathology, and the rest of my time I'm working towards my thesis-based master's degree. And so for that master's, I focus on infectious diseases of honeybees, particularly American FoulBrood. So this will be the first in a series of presentations on infectious disease. And American FoulBrood, we're starting with really one of the big heavy hitters. So this is one of the ones that you absolutely need to know about. So when it comes to framing this talk today, we're going to just start off by keeping it simple, talking about the actual causative agent of the disease, as well as some of the most important points about the disease itself. From there, we'll spend quite a bit of time talking about pathogenesis as well as transmission, and this will be reviewing some of the concepts that Dr. Simcoe brought up earlier in one of his first presentations. We'll move on to gross pathology, so taking a look at a lot of images on how do we actually recognize this disease. Then talking about diagnostic techniques and differentiating between laboratory diagnoses and, oh, am I doing something wrong? Oh, I see. See, it's a good thing I've got people here to help me out. It's kind of hanging there, but let me know if that fixes. Then we'll talk a bit about determinants of disease. I'm going to take a bit of unique spin on this one. So those are those factors that decide upon exposure to this pathogen, what actually leads to the development of clinical disease or not. And so we're going to talk about just a couple of unique examples to eusocial organisms that we don't necessarily talk about when we're thinking of our normal domestic mammalian species. Okay. Then we'll spend a little bit of time on disease management and prevention, but not too much. That won't be the heavy emphasis of our talk here today. And then we'll move to current research. It seems we're running into technical problems again, so. Okay. Are things still working okay? Am I still projecting? Okay, great. Perfect. We'll roll with it and see how it goes. So I'm really just, when it comes to this talk, I'm just trying to frame it as a general overview. I recognize that there's a wide range, a wide demographic in terms of the audience today. And I also realize that there are people from a lot of different jurisdictions and regions. There's definitely a bias in this talk towards management practices in North America, specifically Western Canada. But please keep in mind that different jurisdictions will have different protocols and different ways that things are done. So focusing on etiology and disease. The causative agent of American FoulBrood disease is a bacterium, and it's called Penibacillus larva. Now, this bacteria, it's gram-positive, rod-like, and facultatively anaerobic. And often when you're looking under the microscope, you can see that it forms chains. So here on this image on the right, we can see these rod-like organisms that are forming chains. These are Penibacillus larva bacteria that are currently replicating within the gastrointestinal tract of a honeybee larva. Now, when I'm describing this disease to veterinarians or pathologists who are unfamiliar with it, I usually draw a lot of comparisons to anthrax, which is a much more well-recognized or well-known disease of mammalian species. And both anthrax and American FoulBrood have bacteria that are endospore forming. But from here on out, I'm just going to refer to endospores as spores. That matches more with the common vernacular when it comes to describing this disease. And so if we have a spore forming bacteria, that means we'll find it in one of either two states. So the one state in which we can find the bacteria is here as the vegetative state. And this is a state that is responsible for proliferation or replication. Under certain environmental cues, that vegetative bacteria can undergo sporulation, where it will transform into a resilient and infectious spore. Likewise, under the right environmental cues, that spore can undergo germination to become a vegetative bacteria again. So American FoulBrood, it's not something that's specific to America. It is widespread across the globe in all areas where there's apiculture present, and very similar to anthrax, it is capable of causing devastating fatal infection. In fact, when we talk about a bunch of the different brood diseases that will be covered today, this one is the most devastating brood disease of honeybees. And that's because American foul brood has a couple of really unique characteristics to it. The first is that these spores are extremely infectious to young larvae, such that the LD50 is less than 10 spores. So what that means is that it takes less than 10 spores to cause fatal infection in 50% of a tested larval population. In addition, the vegetative state of this bacteria is extremely prolific. So we can see production of up to 2.5 billion spores per individual larva that's infected. So just between these two things, it's really easy to imagine how we can go from just a small handful of spores, like a tremendous number of spores in a relatively short period of time. Again, drawing comparisons here to anthrax is the resiliency of spores. So much like spores of Bacillus anthracis, spores of Penibacillus larvae are capable of maintaining infectivity for decades within the environment through environmental extremes, summers and winters. They're also able to withstand antibiotics and many common disinfectants. So if we actually see clinical disease in a hive, if it's left unchecked or untreated or goes unrecognized, it can rapidly lead to colony death by completely wiping out the brood population within that hive. However, it's kind of a darned if you do, darned if you don't situation if a beekeeper recognizes that there is clinical AFB, American foul brood disease, in their hive. They will willingly destroy that colony, usually through burning of the hive here, and that's to limit the spread of disease. So whichever way you cut it, please recognize that there is significant economic cost associated with AFB. Perfect. So now we'll move into pathogenesis and transmission. So how does that larva actually get infected, and what happens inside once it does? So to do that, I'm going to use a series of cartoons that I've put together, but we need to kind of set the stage here a little and just remind ourselves of a couple of basic principles and have them in our mind's eye as we go on. The first one here is just when it comes to larval development. So this is a really, really useful diagram right here. On the left with day 1, that's where we see the laying of an egg. And then each of these subsequent numbers refers to a different day in larval development. And so the top one here, we see worker development, the middle one is drone development, and the bottom one is queen development. Now, it's important to recognize that American foul brood is capable of causing disease in all 3 of these castes. For our purposes, though, we're just going to use the worker development here at the top as a reference. The second thing that we need to keep in mind is what these cells actually look like. And so if we're looking end on or taking a transverse section of a cell, we see what we classically think of in terms of these hexagonal cell entrances that form this honeycomb pattern. If, however, we flip these on their side and look at the longitudinal section, we can see that these cells are quite deep and they form a conical little point at the bottom. And importantly, that these cells slope towards the bottom. So there's about a 9-degree angle of sloping here. And this will be important when it comes to making sure you orient frames properly when you're looking for clinical signs. So keeping these things in mind, we can recognize, yep, when we're looking end on at the cell, we can see that classic sort of hexagonal honeycomb pattern. And when we're looking from the side, we see these deep cells with the conical points at the bottom. So great, we've got recognition here of what the larval development looks like at the top. And now we can orient in our mind that we're looking at a longitudinal section of the cell right here. So we'll start with just our little box up here in the top left where an egg is laid at the bottom of that cell. Nothing really interesting is happening here. So we'll shift ahead to when that egg hatches. And there, ta-da, we have a little first instar larva. And this is when infection occurs. So if we take a little handful of spores here, remember we don't need that many to cause infection within a larva. That larva will unknowingly consume and ingest those spores. And this is a really, really key point that I'm going to emphasize a couple of times. Infection only occurs in newly hatched larvae. So larvae that are up to or no later than 36 to 48 hours old. If any larvae that are further on development here ingest spores, they will not go on to develop American foul brood disease. Same thing when it comes to newly emerged or adult bees. If they consume spores, they will not go on to develop American foul brood disease. It is only those newly hatched larvae that are ingesting these spores that will develop AFB. So within 12 hours of ingesting those spores, we'll see germination. Remember, that's the transformation from the spore state to the vegetative prolific state. And we'll let things be. Over time, that bacteria will grow. Here, after a couple of days, we now have this nice fat bacteria or fat larva that's sitting at the bottom of the cell, and it's curled up here. And as it's growing, if we take a look on the inside where this dotted line represents the midgut, we can see that that small handful of vegetative bacteria are concurrently replicating and starting to fill that gut at the same time. However, right now, things are okay. These bacteria are minding their own business. They're essentially acting as commensal bacteria as part of the flora in the gut, where they're just feeding off of the incoming nutrition and replicating themselves. Time will go on here and we'll see progression, where now that larva has grown large enough that it fills the entire cell and now sits along the longitudinal axis, and worker bees will come by, they'll place a cap over that cell to prepare it for pupation. But again, while this is going on, those bacteria will continue to replicate and proliferate within the midgut. Here, something changes. There's a switch where instead of acting as these nice peaceful bystanders, instead of acting as nice commensal organisms, these bacteria will start to release digestive enzymes, mainly proteases, that will allow them to break through the midgut and invade into the surrounding hemocoel of this larva. Once they do that, they set up and establish a septicemic infection within these larvae that kill them. So if we're looking from the outside, we would have had this really, really nice, fat, plump, pearly white larva that instead now is dead because it's slowly being digested by the enzymes released by this bacteria. So this larva will start to slump down and sink down to the gravitationally dependent part of this cell, and it will take on this kind of tan to coffee-like color as well. And again, on the inside, what we're seeing at this point is just a tremendous amount of these vegetative bacteria. Now, the larva is dead, so there's no more incoming nutrients. And so these vegetative bacteria now are starting to get a few cues where it's time to start to sporulate. And so we'll start to see a buildup of spores within this dead larval tissue. Concurrently with the death of the larva, we'll often see changes to the cell cappings. We'll talk about this a little more later on, but one of the most common things that we see is perforations in the cell cappings. And if you remember Dr. Simcoe talking earlier, when it came to like opsonization or recognition of abnormal cells. Now, given enough time, if this larva is not cleared out, we will see the larval remains continue to dry out and they'll desiccate until we're left with this really gnarly looking dried larval scale that again sits on that ventrolateral cell wall. So it sits on the gravitationally dependent part of the cell. And if we think about what's going on the inside, where we had all of these vegetative bacteria, now they have all undergone sporulation. So these larval scales are just packed full of new infectious spores, again, up to 2.5 billion spores per infected larva, that through the actions of the degradative proteases from the vegetative state have broken down what's left of that larval tissue and are ready to transmit then throughout the hive. So that leads us to how transmission actually occurs. And again, this is just a bit of a reiteration of some of the topics that Dr. Simcoe covered. First, we need to think about intra-colony transmission, and this just refers to spread of spores amongst larvae and bees within a colony. And contrast this with inter-colony transmission, or the spread of spores and disease between colonies. I will just make a quick, brief little point here about vertical transmission. It does occur with American FoulBrood, but only at the colony level. So we only see vertical transmission through swarming or regular colony fission. That is where you see one colony break apart into a mother colony and a daughter colony. However, this is not associated with a significant level of virulence and is considered relatively insignificant in the grand scheme of things. When we think more about transmission on a more classical level through egg or sperm, it's unknown and considered unlikely with this disease. So going back to intra-colony transmission, or the spread of spores within an individual colony, this is carried out by the nurse worker bees. So they'll come by, they'll identify that, whoop, this cell is not doing good. The larva's dead, it doesn't look right. And so they will go in and they will clean out that infected brood cell to make way so that the queen can come back by and lay a new egg. However, by cleaning out that cell, they have unknowingly contaminated their gastrointestinal tract with spores, as well as their mouth parts and forelimbs. And just by the normal sort of routine daily chores that they carry out through in the hive, that's how we see the spores disseminate everywhere. And so through the normal actions of these worker bees that have now contaminated themselves with spores, we'll see new spores end up in larval diet. That will lead to the infection of new naive larvae. So we'll start to see different stages of infection within an affected colony. We'll also see transmission of spores to other adult bees through trophallaxis or the swapping of regurgitated gastrointestinal contents, super delicious. We can also see spores that wind up in food stores, particularly honey, as well as the wax that bees will build up from the foundation. And again, just recall that this disease is one where the infection occurs in young larvae only. Adult bees who ingest spores of this bacteria will not go on to develop American foul brood disease. So spores will not germinate. And so when we're really thinking about adult bees with this disease, it's really kind of best to think of them as an insect vector that are responsible for moving spores from one location to another. All right, intercolony transmission. So we've got spores now that have just spread all throughout the colony. How do they get to the next colony nearby? And so one of the most significant means that this happens is through robbing behavior. And recall from Dr. Simcoe's earlier lectures, robbing behavior is defined as foraging bees from one colony, a strong colony, that find a weaker colony and they steal honey from it because it's a great source of easily accessible honey. Now, when we think about American foul brood, again, essentially we have the entire brood population that's being wiped out. We're not getting continual replacement of these aging and dying adult workers. And so we have a decrease in the population. If there's not enough bees to go around within a hive, they're not going to be able to carry out their normal sort of daily operating tasks, which includes guarding the colony from invaders. And so these AFB weakened colonies will be very susceptible to robbing from other stronger nearby colonies. And so these stronger colonies will send in foraging bees, they'll collect all the honey, they'll think score, this is great, they'll bring back all the honey back to their strong hives, but what they've actually done is just returned a bunch of new spores back to their colonies where new infection can be established. Again, I can't understate enough that management practices of beekeepers themselves are super, super critical when it comes to transmission of spores between colonies. And this can occur from the swapping of frames and honey supers between colonies within a yard or between colonies within different yards. This can also occur if we have inadequate prevention of robbing behavior. So if there's not a lot of natural forage or nectar around, making sure that we're supplementing bees with feed, particularly at the end of the season, to discourage robbing behavior. And this can also occur if there's delayed removal of weakened and or dead colonies. If you recognize a dead colony and you can't remove it right away, again, making sure that it's properly sealed so that nothing can get in there to rob out anything that might be inside. Also make mention here that the drifting of bees or just the movement of one bee kind of switching allegiance from one colony to another has been implicated in the intercolony transmission of American foul brood disease. However, the significance of it is debated. There are some papers that seem to show it very clearly, others that don't. Regardless, we'll kind of just demonstrate an example here. It's a bit of an older study by Mark Goodwin from New Zealand Beekeeper. What he did in this study is he essentially swapped supers and hives around that had different levels of contamination. So here up in the top right, a green box just means a hive box that has no detectable spores in it, so a clean hive. A pink box is a hive box that has low levels of spore contamination, and then a red box is not very good. That's a box where if you were to look inside of it, you would see clinical American foul brood disease. And so in this study, Mark took 20 colonies that had no detectable spores, and what he did was he placed 20 boxes on top of each of these, and those boxes came from other colonies that had light AFB infection. Then he took these 20 colonies, put them into a closed yard with 20 more that were clean. And he left them over time to see what would happen. And we saw something like this. So within 48 hours, samples of bees that were taken from every single one of these colonies were positive for detection of Penibacillus larvae spores. In addition, over time, 9 of the colonies that had received contaminated supers developed AFB disease. And even 4 of the colonies that did not receive any contaminated supers still went on to develop disease. it was important to note in this study, they didn't notice any robbing behaviors. And so they really think that this was mostly the result of, again, placing these contaminated supers on top of clean colonies and potentially some role of drifting bees as well. But at the end of the day, this is just a really great example of how easy it is to unknowingly spread spores of this disease through an apiary. Perfect. Okay, so we've talked about what this disease actually is, what happens when a poor little larva actually ingests spores, how disease develops, and how it spreads around. What does it look like? And this is super, super important. So I'm going to really kind of focus heavily on these 4 different clinical signs or aspects of gross pathology. We'll be talking about a patchy shotgun brood pattern. We'll spend some time talking about abnormal cell cappings. We'll move on to larval ropiness, and then we'll discuss larval scale. There are a couple of other clinical signs as well. I'll mention them at the end here, but these are the ones where as a beekeeper is going through looking at the frames from his hive, these are the main signs that he's going to be recognizing or looking to identify. So we'll start with a patchy shotgun brood pattern, and I'll just put this image up here. This is a normal frame. And again, I just want to draw your attention to our normal sort of brood pattern here. And it looks really great. We've talked a lot about how we're looking for synchronous brood patterns. And here you can imagine that, yeah, a queen really took her time and was very meticulous in terms of going cell by cell and trying to make sure that every single cell was filled with a new egg. We see the odd open cell here or there. That's okay. Sometimes they're filled with a little bit of honey or other food, but this looks like a really nice synchronous brood pattern. Now, contrast this with the image or the frame on the right here. And this is a shotgun brood pattern. And so what I mean by that is essentially imagining loading a shotgun with buckshot and blasting it at the frame. And so instead of this nice homogeneous synchronous pattern here on the left, we see this really patchy pattern with the capped brood that are left there. And if we take a closer look, again, we've talked a lot about synchrony and asynchrony of brood development here. Here, you can see there's quite a bit of asynchrony where, yes, we still have some of these cells that are capped over, but if you look, especially in some of these cells here, there's different stages of development where we have uncapped developing larvae. And if you were to look in even some of these other ones, if you take a really close peek, you can see where there's been new eggs laid. So this asynchrony is reflective of something wrong going on with that colony. But it's important to emphasize that this is a non-specific finding. There's a lot of different things that can cause this. Differential diagnoses do include a lot of our brood diseases, so American foul brood, European foul brood, also varroa mites, which will come up in conversation later today, or the fungal disease nosema. And remember, it doesn't necessarily have to be infectious causes either. A failing or aging queen can also have a patchy brood pattern like this, as well as laying worker bees or pseudoqueens. All right, so if a beekeeper was to take a look at the frame and go, wow, that's really patchy, often the next sort of thing that they'll look for is they'll start inspecting those abnormal cappings, or they'll look for like kind of the isolated cells and see what does the capping look like. And so with this image here, I hope you guys can recognize that it's something, even if you don't know quite what, but something doesn't look quite right. And so a lot of these cell cappings have a sort of moth-eaten appearance to them. They look a little bit sunken, they look off in color, and they look like they have a bit of an abnormal texture to them. And again, when it comes to changes in cell cappings, this is another non-specific finding. It can be suggestive of American foul brood, but it's not so much of a slam dunk. But if we're worried about American foul brood disease, we'll be looking for cappings that appear darkened, greasy, or sunken. And so here we've got an image of a normal looking capping. It looks nice and dry. It looks nice and flat. It's got that bright yellow color. Contrast that with one of American foul brood disease, where instead it's got this really dark discoloration to it. It looks like if you were to touch it, it could almost have a greasy texture, and it's quite warped, and it's got a sunken sort of appearance on the surface here. Second finding we'll look for with abnormal cappings is holes in the cappings. And this occurs when worker bees come by and they recognize through olfactory cues that something is not going correctly with the development of the larva underneath that capping, in this case, disease from American foul brood disease. And so they will mark or flag these cells for cleanup. And by doing that, they'll chew these off-center irregular sorts of holes so that when other bees come by, other worker bees come by, they will see that, oh, this has been marked for clean out, and they will go and proceed to chew everything out, clean out that cell. And if there's American foul brood there, potentially spread spores throughout the colony. Now, it's important that these abnormal chew marks or marks need to be distinguished from normal holes during development. And two of the most common normal holes we see during development are during capping, normal capping, and emergence of a new honeybee here. So with normal capping, we expect to see these holes that tend to be right in the center, and they seem nice and smooth. And if you were to leave these, put them back in the colony, and then take a look a little while later, these would be fully sealed over. On the other end, a bee that is emerging from its cell after completing development, these holes will be irregular, similar to these marks over here, but they will be quite large and they will be quite central. And if you're looking at a hive that's still alive, you'll often see the bee kind of poking its head out underneath. Okay, we'll move on to larval ropiness now, which is shown just by this glue-like string that's identified by this arrow here on the end of this Q-tip. And if you guys remember, kind of back to my little cartoon here, what's that? Oh, is it frozen? Uh-oh, let's see. Is it, what is it showing right now? Turn off the camera? Okay. Sorry guys, technical difficulties again. Is it working? Yep, perfect, okay. Yeah, that's perfect. Yeah, if you can just angle that towards me, just so I can see if it's not working properly. Okay, great. The camera isn't working, but that's great. Hopefully it froze on a good facial expression. So if you guys remember back to our cartoon drawing here, just when I was describing the pathogenesis, larval ropiness is tested on those larvae that have died. The remaining larval tissue is being digested, broken down by the proteases and digestive enzymes that are released by the vegetative bacteria. So, this larval ropiness is considered nearly pathognomonic for American FoulBrood disease. The reason I say nearly is there are some other infections that can mimic ropiness, and they're termed pseudo-ropiness. So particularly if we see European FoulBrood disease with a concurrent infection by other secondary bacterial invaders, they can still kind of form this ropiness. Now, to actually test for ropiness, you take some sort of probe and you insert it into your suspect cell down here, and then you try and draw that probe out to look for what comes out. And what you're looking for is a glue-like ropiness that may be drawn out to 2 centimeters or more. In addition, this ropiness should have a tan to coffee-like color. Now, the main reason for this long sort of stringy ropiness when it comes to American FoulBrood disease is kind of twofold. The first one is remembering that what actually is within this larval remains is a large amount of these vegetative bacteria. And the outer surface, the capsular surface of these bacteria is predisposed to kind of clumping and sticking together. Remember, these can form chain-like sort of groupings. And so because there's so many bacteria there, they'll form these clumping sort of chains. The rest of this ropiness is the result of these breaking down larval tissues. So remember, they're just kind of digesting due to the actions of these vegetative bacteria. So these two things together will contribute to this long sort of ropey string. If we see pseudo-ropiness, it shouldn't stretch out this long, but it can be difficult to differentiate at times. All right, finally, we'll move on to talking about larval scale. There we go. Sorry guys, there's just a little bit of lag between my computer and I think what you guys are seeing, so I'll try and just compensate. So when we're talking about larval scale, it's indicated by each of these arrows. And if you remember earlier in the presentation, larval scale is if we've given enough time for the larval remains to dry out and kind of form this firmly adhered brittle scale that sits at the bottom of the cell. And these scales are going to be filled with infectious spores. Now, this is considered pathognomonic for American FoulBrood disease. It's important to note that other diseases, sorry guys, it just seems there's a bit of a hang up with the presentation again. I'm sorry, I'm not sure what I'm doing wrong, that it's not.
No, it's
let's see. I can try close it all out again and then start it again.
It looks good on our end, Mike.
Oh, you guys are seeing like it says larval scale with the word pathognomonic on it?
Yep, that's what we see.
Oh, okay, great. So, all right, I'll continue on then. Sorry about that. Again, so as I was saying, when it comes to this being pathognomonic, it's important to note that other diseases can form scales. European FoulBrood can form scales as well, but only American FoulBrood forms a brittle, firmly adhered scale on the ventrolateral or gravitationally dependent portion of the cell wall. The other important thing to keep in mind from a clinical perspective is that this is, again, representative of the desiccation of larval remains. And so this is not going to be a feature of early infection. We are only going to see this if infection has been kind of brewing for quite a ways. That said, it can be really difficult to identify larval scale, especially if it's the same color as the surrounding cell or it's quite subtle. And so these are just a few tricks that you can use to try and improve your ability to recognize it. The first is making sure that you have some sort of a bright light source behind you, and then making sure that the orientation of the frame that you're looking at is in the right orientation. And so just remembering that there is a bit of an angle here, so a downward slope towards the bottom of the cell. So you're trying to make sure that you're orienting that slope properly. So you're actually looking at what is the bottom of the cell wall here. Then from there, you'll use the light source to try and light up the bottom of the cell here. And it should look something like this. So in this image, we have a beekeeper who is holding a frame, who is looking towards the bottom aspect of the cell. And they're trying to use the light source again, just to light up the bottom part of the cell. And you can see here that, yeah, we're getting lighting up these edges of these larval scales that are sitting down there. Perfect. I did mention that there are other findings, clinical findings that are important with American FoulBrood disease. One of them that's the most obvious is the development of the characteristic fish-like odor, where the term FoulBrood is derived from. This may or may not be present, and some people are better at sniffing it out than others. Me personally, I'm not very good at smelling this smell. But just because you do not smell this fish-like odor, do not rule out American FoulBrood disease. It still might be present within that colony. Second is a finding called pupal tongue. And so this refers to when we see this thin thread that's stretched across the opening of the cell here. And this is a reflection of late pupal death. So these larvae would have still been infected, again, within the first couple of days following hatching, but it would have taken them longer to die for some reason, and they wouldn't have actually died until they had developed into a full pupa. And so here, this individual larva had died not so long ago. It still has that really brown sort of mushy appearance to it as those tissues are breaking down. This is one where you could imagine if you were to try the Ropiness test, you would find that there would be a positive Ropiness test and a lot of rope that would pull out. Whereas this one on the bottom, we can still see that pupal tongue that's stretching across here. But this is a much older death here, where there's been a lot of drying out and a lot of desiccation, and it's approaching an appearance more like scale. Now, this finding is rarely observed, but if you do see it, congratulations, it is considered pathognomonic for this disease. Perfect. So that kind of touches on some of the main gross pathology findings with this disease. Now let's shift to discussing some of the diagnostic techniques that are important. First is when it comes to a field diagnosis, and this is defined as the demonstration of clinical disease, or American FoulBrood, within a hive. This is largely achieved through demonstrating some of the characteristic pathological signs, so especially scale or ropiness. But there are also these field side tests, including immune-based ELISA kits that can be used as ancillary tools. So this kit down here on the bottom right is a lateral flow device, and it's essentially like a pregnancy test. So if you're unsure of your field diagnosis, you can often have these on hand to look if you see the development of a line that says, yes, this is positive down here. Second is when it comes to talking about a laboratory diagnosis of American FoulBrood disease. And this is contrasted with a field diagnosis. A laboratory diagnosis is really defined as the isolation of Penibacillus larvae using laboratory techniques. There are a lot of different ones that are relied on out there: direct microscopy, using gram stains or other special stains to highlight the formation of spores. Biochemical profiling, so applying different biochemical tests like a catalase test and recording positive or negative reactions to try and develop a profile that's consistent with Penibacillus larvae. Microbiological methods, so bacterial culture to try and recognize that spores are present. So up here in the top right, we can see just regular Columbia sheep blood agar, and this is the morphology of vegetative P larvae on that media. Here on the left, we've got, again, just vegetative P larvae that are developing on a more semi-selective media, MYPGP. Finally, there are also many molecular methods that can be used, specifically polymerase chain reaction, PCR, or multi-TOF mass spectrometry. Now, it's really important, and I'm going to make this comment a couple of times, that a laboratory diagnosis in isolation does not necessarily mean that you have American foulbrood disease. So just being able to detect spores of this bacteria, again, does not necessarily mean that you have the clinically active disease going on. Now, when it comes to making a laboratory diagnosis, we can isolate spores from multiple different types of samples. So we can isolate them from larval tissues, such as scale, if we're trying to confirm a field diagnosis. This makes sense. We can also isolate spores from adult bees. Again, remember, bees are essentially insect vectors for spores of this bacteria. We can also find spores in hive products, such as honey. We can find them in the hive debris. Remember, kind of the detritus that builds up on the bottom board of the hive, as well as sometimes within the wax itself. Now, the detection of spores has a wide range of applications. Again, as I mentioned, it can be used as confirmation of a field diagnosis if we're using scale or ropey remains. It's also used a lot in different surveillance programs, such as the surveillance program in New Zealand up in the top right there. And for detecting spores for surveillance, this often comes down to detecting spores from bees or brood honey that's collected from the brood chamber itself. Detecting spores can be a predictor of current colony health status. What I mean by this is if you're looking at a colony and you can't quite identify if there's clinical disease that's going on there, you can sometimes test for spores. And if it's reached past a certain threshold, you can be more confident that although it's there and although it's subtle, there's most likely clinically active disease occurring. Extending this application, we can also use detection of spores as a predictor of the risk of future development of American foulbrood disease. So testing a sample, seeing that there's a large number of spores there and going, okay, there might not be American foulbrood now, but there's a low, medium, or high risk to it developing in the future. And then finally, last but not least, detection of spores is often used as screening during importation of hive products, such as testing of extracted marketable honey to see if it's acceptable for importation to a jurisdiction or not. So all this said, again, remember, just the detection of spores alone is not enough to make a definitive diagnosis of American foulbrood disease. It's just enough to identify that spores are present. So to make a definitive diagnosis, we need two things. First, we need to be able to demonstrate that clinical disease is currently there within the hive. And second, we need to confirm through a laboratory diagnosis that the clinical signs that we're seeing are due to Penibacillus larvae. And this is really, really similar to a lot of other different diseases that we work with as pathologists. The one example that often comes to mind is Clostridium shovii, or the causative agent of black leg disease in cattle. Now, if you were to have a dead cow, we were doing a postmortem examination, and you were to detect Clostridium shovii on culture, but you weren't able to see the typical signs in skeletal muscle, that would be not enough to make a diagnosis of black leg disease in that animal. You need the combination of being able to see the necrohemorrhagic rhabdomyositis in combination with the isolation of the causative agent, Clostridium shovii, in terms of being confident about that diagnosis. And the same thing is true for American foul brood disease. Again, demonstration of clinical signs and isolation of the agent within the laboratory. So I've mentioned a couple of times now that just having spores present is not necessarily enough to claim that disease is there. So what are the things that actually drive the development or the appearance of clinical disease? This comes back to the really basic relationship between pathogen, environment, and host. A lot of these things, even if you don't have any experience with veterinary medicine or honeybees, you can think through these things logically. So if a colony is exposed to a large number of spores, it's more likely to develop disease than if it was exposed to a small number of spores. If environmentally, these hives are kept in a very crowded environment where there's a high density of honeybees, that can improve transmission and lead to the development of disease. Really from the purposes of this talk today, I just want to focus on what I think are a couple of really cool examples from both the pathogen perspective as well as the host perspective that are important determinants of disease. And they're unique to these eusocial organisms, honeybees. And so the first one from the perspective of the host, we've already touched upon in earlier lectures here. And we're kind of shifting our focus. Instead of thinking about an individual honeybee, we're thinking of the colony as a whole as being the most clinically relevant here. And so again, this comes back to hygienic behavior of a colony, which is determined by these freeze-kill brood assays. So just kind of reviewing what Dr. Simcoe had taught us earlier, again, we take this really discrete area of capped brood, we pour on liquid nitrogen to kill those brood, and then we place that frame back in the colony. And after a determinate amount of time, we'll take that frame back out and look to see how well did the worker bees do at removing those dead capped larvae. And so here again on the left, this is one where we still see that they didn't do the greatest job. There's still quite a few dead larvae that are left. And contrast this with the one on the right where most of those cells are now cleaned out. And so this colony on the right would have a higher hygienic score than the one on the left. And so how this relates to natural resistance to American foul brood disease, the thought is that these nurse bees from highly hygienic colonies are able to remove infected larvae before we see significant amounts of sporulation. So we don't see a high buildup of spores in these colonies. And so these colonies where beekeepers have selected through these highly hygienic queens have a higher level of natural resistance to American foul brood disease. Shifting now and thinking more about the pathogen, it's been demonstrated in multiple papers that virulence of Penibacillus larvae is often dependent on genotype, and specifically, it's often talked about these ERIC genotypes, 1 through 5. For most clinically relevant purposes, though, we only talk about ERIC 1 and 2. They're the ones that we identify in the field. The remaining genotypes are either new or relegated to laboratories. And the really cool thing about this with honeybees is that there's a negative correlation between colony level and larval level virulence. And I'll use this table down here just to explain what I mean. So bear with me here. This is a really cool concept. So here on the left, we've got two genotypes, ERIC1 genotype and ERIC2 genotype, and they differ in terms of their virulence. So for ERIC1, it takes about 12 days to kill a larva after infection, whereas with ERIC2, it only takes about 7 days. So focusing on ERIC1, it takes about 12 days to kill a larva. That means we have a higher proportion or a greater percentage of larvae that die after the cell has been capped. As a result of this, it takes longer for bees to recognize and remove those dead larvae. And so the dead larvae are hanging out in the colony for a longer period of time, and there's a greater degree of spore production as a result. With ERIC2, kills larvae very quickly, and so most larvae die before any capping can occur. And so as a result, it's relatively easier to recognize that there's a dead larva there. It gets cleaned out rapidly, and there's not enough time for that larva sitting in there for spores to develop to any high number. And this comes down to, yeah, ERIC1 takes longer to kill an individual larva, but that actually is horrible because it allows for a greater buildup of spores that are able to transmit within that colony. And so that colony actually dies a lot quicker. So when we have low larval virulence, we see high colony level virulence. Flip this with the ARIC2 genotype, where because it kills larvae very quickly, those larvae get removed from the colony before spores can really build up. We see relatively low colony level virulence. Excellent. Okay, so now we'll just shift into disease management and prevention. And here I'm just going to be focusing on some of the key points. Again, it'll really come down to different jurisdictions and legal requirements. I'm not going to be covering everything here, but just again, some of the key points. Really, when it comes to managing this disease, one of our main goals is to take on this multifactorial approach to preventing and managing it. And so we use this term integrated pest management. This includes concepts of biosecurity, which from the perspective of honeybees includes segregating equipment within dedicated yards. So again, trying to avoid swapping equipment or materials between different yards, keeping them in their own places, as well as discouraging robbing behaviors. So bees from a nearby yard are not able to come in and rob out honey from the yard of focus. Regular replacement of brood frames is also very important, as Dr. Simcoe had mentioned. So again, trying to do complete replacement in these cycles of every 4 to 5 years. We're replacing 20 to 25% of brood frames on an annual basis. Genetic selection, primarily through the hygienic behavior at the colony level. And then frequent, thorough inspection for early detection. And if you do identify that there's any clinically affected colonies, promptly destroying them to limit and prevent the spread of infection further. The role of antibiotics, the most important thing that I can say when it comes to antibiotic use is that is non-curative. What I mean by this is antibiotics, when used to treat colonies, only prevent the replication of the vegetative state of bacteria. The spores, again, are very resilient and they're unaffected and unadulterated by antibiotic treatment. And so even if you use antibiotics and you can eliminate clinical signs because you're getting rid of the vegetative states of bacteria, those spores are still going to be there and they're still going to be infectious. And so the use of antibiotics is mostly relegated to metaphylaxis. And again, this is only legal in some regions such as North America. Antimicrobial use is prohibited in places such as the European Union or New Zealand. In places where it is allowed, it's often relied upon heavily. When it comes to therapeutic use, so if you were to identify a clinically affected hive and it had signs of American FoulBrood disease, therapeutic use is not recommended and quite often it's prohibited. Again, the most important thing that you can do is to eradicate those spores. And the way to do that is through the burning of that colony. A little bit of a plug here. If you're interested in learning more when it comes to antibiotic use or standardization of prescription of antibiotics, I will refer you to one of our more recent publications that came out in the Canadian Veterinary Journal. I especially encourage this is reading for our practicing veterinarians here in Canada. We tried to make this a really good way to deliver some continuing education, and there are protocols in there for handling suspected cases of AFB as well. So I'm just going to leave that up for a quick second and take a quick drink of water. Okay, perfect. All right. So we'll close out the talk today just with a discussion about some of the current research projects that we have going on here at the University of Saskatchewan. And it's useful that we just talked about metaphylactic antibiotic use, because that is really what a lot of our research focuses on. So in North America, here in Saskatchewan, for example, there is an over-reliance on antimicrobial metaphylaxis. And again, that's because treating with antibiotics does nothing to the spores. And so it kind of forms this vicious cycle where you treat with antibiotics to keep clinical disease in check. And then the concern exists that if you remove antibiotic therapy, if there's still spores there, then you can see disease emerge. And so in order to maintain profitability of operations, there's often a reliance on antimicrobials to make sure we don't see disease emerge. That said, though, there is growing concern regarding antimicrobial use, and we have seen over the last 30 years the emergence of resistant strains of P. larvae, particularly to the antimicrobial oxytetracycline. This has necessitated the use of other antimicrobials, And both in the US and in Canada, within the last 3 to 4 years, we've seen increased veterinary oversight on how these antimicrobials are used. And this is not just specific to apiculture, this is across all of our important livestock species. So at the end of the day, the way that apiculture is working right now in terms of this metaphylactic antibiotic use, it is not sustainable on the long term. So there needs to be alternatives in terms of effective ways that beekeepers can make decisions about managing and preventing this disease. The problem is that the current predictive methodology for AFB risk is insufficient. So being able to test the risk of AFB is often focusing on individual medicine, so a hive by hive basis. And this is relatively laborious and it's inefficient, particularly for our commercial operators who have upwards of 5,000 or more producing colonies that they're managing. So with our research, on the left here, we have more of an individual medicine perspective. What we're trying to do is we're trying to shift things. So instead of making decisions on a hive by hive basis, we're instead looking to take more of a herd health medicine approach where we can make decisions on a yard by yard basis. So instead of making individual hive, we're trying to make a decision based on 40 to 50 hives at a time. And we can do this through the use of honey extractors. We're able to exploit them. If you remember, these are the big machines where you can take multiple frames, load them in, these will spin, and through centrifugal force will pull off the honey that will collect underneath. And so a single load within these big extractors will represent multiple colonies within a yard. So we're capturing multiple colonies at a time. And this is relatively more convenient for beekeepers. They're already extracting the honey anyways. It's easier for them to collect a sample off the bottom here instead of going out on a hive by hive basis and collecting individual samples. The main limitation with this is that there's reduced sensitivity of extracted honey relative to populations of bees that are used as samples or honey samples from the brood chamber. However, a lot of our work in the laboratory has gone towards developing specialized media that enhances germination of spores to try and overcome this limitation in sensitivity. And so this is some of the results that we have right now. We've been actually quite successful. So each of these little dots is representative of an individual sample of honey measured in terms of spores per gram of honey. And these are from a lot of our commercial operators here. And we actually have this really great spread of data right now where we've got a large cluster that have relatively low contamination with spores in their honey samples, those that have what we consider a moderate level of contamination, and those that have a relatively high level of contamination. And so right now we're working with these beekeepers to try and follow up and see, do these high levels of contamination correlate with disease? And from there, we're hoping again to develop a viable test using extracted honey that predicts for the risk of American foul brood at the yard level. So again, being able to test a honey sample, see the number of spores that are there, and relay back to the beekeeper that this is a low, a medium, or a high risk for American foul brood disease. And through this, we want this to be able to slot into integrated pest management programs where beekeepers will be able to make more informed evidence-based decisions when it comes to the management of the yard, and then hopefully reduce the reliance on antimicrobial use in their operations. So in summary for today, the big take-home messages that I want you guys to remember this: AFB is caused by a spore-forming bacterium. So when you're trying to think of American foul brood disease, the best comparison to make is thinking about anthrax and mammalian species. And these spores are resilient, and it's the resiliency of those spores that cause such a headache when it comes to managing this disease. Clinical signs that we're really looking for include larval ropiness, again exemplified here on the right, as well as the larval scale that forms on the ventrally gravitationally dependent bottom part of the cell wall. And this disease is associated with significant economic cost, either through the natural progression of the disease itself or by the willing destruction of the colony by the beekeeper himself or herself to limit the spread of disease. A definitive diagnosis requires two things. It requires both clinical signs and isolation of the pathogen. Just identifying spores of Penibacillus larva alone is not enough to label it as being American foul brood disease. You need both clinical signs and the pathogen. And then finally, the laboratory diagnosis or detection of spores has useful applications for risk assessment, which ties into a lot of the work we're doing here at the university. So with that, I will use this slide as a moment to just thank some of our funding agencies. So Project APISM, the Saskatchewan Beekeepers Development Commission, MyTax, the university itself, and the government of Saskatchewan. And I can turn it over to you guys. If you want to reach out to me directly, you can do so. My email is there as well. Thanks. Do that. So I just need to figure out how to look at the questions. This? Oh. Uh-oh. No, it says it's not responding. Hang on. That's what I'm doing. Yeah, Raphael. So we're just having a little bit of trouble. So, oh, hang on. We'll bring up another computer here so I can try and read the questions.
Hi, Mike. Did you want me to read the questions to you in the meantime?
Younger. Okay, I'm just going to try and scroll down to questions about my talk here. Okay, let's see. So when you're, what's that? Yeah, when you are replacing brood frames, what is the best practice for disposal of old removed frames? Alamir, do you want to help with these?
Yes, if you are replacing old frames, you can melt the wax, and wax can still go into circulation and sell it, even if it is with American FoulBrood spores. But you don't want to reuse it for foundation. And in North America, rarely we do. I think that the answer to your question.
Yeah, I think the next question there about expired brood frames is also answered by that. Can the frames be sanitized with heat in an oven? Yeah, so I talked about destroying frames through burning. There are other ways that you can sanitize or disinfect equipment. So hot paraffin, wax dips, gamma irradiation, or high velocity beam irradiation are also methods there. Heat itself, it is challenging to get to the proper temperature for as long of a period of time that you need in order to safely sterilize the amount of equipment that you're usually looking at. Here we go. Knowing that the symptoms differ greatly with genotype of the bacteria, specifically when it comes to ERIC genotypes, do you think we should care about this in Canada? Yeah, this is a really good question. So the predominant genotype that we find here in Canada is ERIC type 1. Remember, this is the one that's associated with a higher degree of colony level virulence. In the European Union, there is a large mixture or a kind of an even split between the prevalence of ERIC type 1 and ERIC type 2. And you're right, they will present in with different signs. So when it comes to like an ERIC type 2, we will not see a lot of ropey brood or the development of scale. And so in those situations, we're relying more on an abnormal sort of shotgun or asynchronous brood pattern there and trying to identify the appropriate causative agent from that point. There has been a couple times where ERIC type 2 has been identified here in Canada and I think the US as well, don't quote me on that, but it's certainly not as prevalent here as it is in other areas of the world. Have you researched radiation treatment in eliminating AFB spores in infected hive materials? I have not personally, but there is a great amount of literature that's out there. It is a viable means in terms of sanitizing equipment if it is available in your region there. And again, that can be either through gamma radiation or high velocity electron beam radiation. Sorry, there's questions from me. Should the pallet the hives sit on be burned if American FoulBrood or European FoulBrood have been diagnosed? So European FoulBrood will come up in conversation with the next talk. It's a good question. If you're trying to be as safe as possible, then sure, you can destroy that equipment as well, as long as it's done in a safe manner. There have been studies out there that have looked at kind of the surrounding environment in terms of contamination with spores. And again, the significance in terms of the contribution to disease transmission is debatable. What stage of development is AFB infecting brood, as beekeepers were told to look for it in the capped brood stage? Yeah, so I will just reiterate this. It's a good question, and I think it just comes down to an understanding of the terminology. So when it comes to infection, the actual infection or the ingestion of spores is only occurring in newly hatched larvae that are less than 48 hours of age. So again, if any bee that's older than 48 hours ingests spores, germination will not occur. We won't see disease develop in those bees. So it's only the young ones that get infected. Then again, thinking of the pathogenesis, it takes time for germination to occur. It takes time for that bacteria to replicate within the gut and eventually break out. So that larva will still continue to develop to a certain point of time where things still look okay. But then at some point in time, the vegetative bacteria will break out of the gut and cause septicemia that will kill it. And that's when we'll see the clinical signs in terms of the ropiness and development scale. Can you please explain how the cappings become perforated? Yep, so this is a result of the actions of worker bees as they come by. And again, they don't need visual cues. They can use what's analogous to like olfactory cues here to recognize that something abnormal is going on with the larva within that capped cell. And they will mark that cell or flag that cell for cleanup by chewing these irregular off-center holes in the cap itself. Is the stimulus for protease production by P larva and manifestation of systemic disease in the larva known? That's a good question, and I'm not fully versed on everything there. If you do want, please, you can send me an email, and there is a useful paper by Ganesh that I can refer you to that is a useful reference there that might help to answer that question a little bit more. Do AFB spores exist naturally in the environment? If not, how do bees get exposure other than through previously infected woodenware? I think I understand what you're asking with this question. So yes, when you need to remember that when we have clinical infection, that a single infected larva is capable of producing up to 2.5 billion spores. That's a tremendous number of spores. And so these spores, again, will travel throughout the colony and we'll find them scattered all over the place. And so they can survive in environmental conditions for years. And it's been demonstrated that spores can remain infectious within the environment for over 35 years at a time. Hopefully that answers that question. If not, please message me afterwards. When constructing frames, is there a top or a bottom on the purchased plastic foundation? There's talk of a 9-degree slope. So no, so there's not. The the foundation is just a flush, and it's the bees that are building that slope themselves. What is the prevalence of AFB in Canada? I will differentiate this question in terms of making sure, again, if you're asking the prevalence of disease versus the prevalence of the bacteria itself. I can speak more in terms of the spores, which is the presence of the bacteria itself. Here in Saskatchewan, for example, through our honey testing, we're finding a prevalence of about 48% of the honey samples that we test have some level of detectable spores. Often it's low levels, but it's there. What is the way to discourage robbing behavior? There's a couple different approaches that you can take to do this. That includes if you have weakened colonies or even colonies where the equipment isn't quite fitting together properly. You'll notice in some of our images, we'll use stones that we place on top to make sure that the top is properly sealed, that bees cannot enter in. And so the only openings that should be available for entry are the bottom board entry as well as the top entry if you're using it. So again, trying to make sure that there's not a lot of space that bees have to defend. The other important thing when it comes to prevention of robbing behavior is making sure that in times, particularly at the end of the season, when nectar flow is slowing down and there's not a lot of environmental resources available, that you are supplementing feed before going into the winter months, so that those bees are less likely to go out and rob. Can AFB bacteria spontaneously generate from environment conditions around the apiary, or must the bacteria be brought into the hive via other bees, equipment, or beekeeper actions? So in order to develop a spore, it needs to have come from a vegetative bacterial state. And those vegetative bacteria are only going to be found within the midgut of the young developing larvae. So if in terms of them spontaneously appearing, environmental conditions are not conducive for the vegetative state of bacteria. So a spore would have had to have come from the midgut of an infected larva. And holes appear in the brood due to other diseases as well, not just AFB. Yes, so it's a non-specific finding, so we can see it occur with other diseases. Again, it's just the action of worker bees that are coming by and recognizing that something is abnormal. It might be American FoulBrood, but it could be other things as well. So the FoulBrood spores are then introduced rather at the end of the summer when robbing occurs more frequently, and then it exhibits itself in the following spring when the eggs are laid and larvae develop. Our routine cultures doing frequently before the winter. Again, there's a lot of different, I tried to simplify this talk down a little bit, but there are a lot of different determinants of disease that together will decide whether or not disease development actually occurs at a given time. So this can again relate back to the pathogen itself. So the types of spores that a colony has received, to the type of genotype with its virulence, to the host and the degree of hygienic behavior, its propensity to rob other colonies, to the environment in terms of what's out there. So it's a bit of a heavy question, and again, it's mostly just the take home that robbing is a very, very important aspect when it comes to transmission between colonies. Okay, I'll take 3 more questions here. So, based on intercolony spread of American FoulBrood, do you highly discourage capturing swarms? If capturing swarms is okay, I am assuming that we should treat this swarm in your new hive with antibiotics immediately. Correct. Any other comments? So again, when I was making a comment about vertical transmission at the colony level, this was relating to swarms. So we can see spores that end up within the daughter colony. However, there is research that's been done in New Zealand, I believe, where they were going out and they were looking at swarms. And they were finding that there was not a lot of virulence or not a lot of evidence for American FoulBrood disease there. So as for the rest of your question in terms of when it comes to treating, that depends on all of the different management practices that you're currently using. Again, vertical transmission has not been shown to be a major player when it comes to transmission of disease, but I would try to emphasize in terms of the other aspects of integrated pest management, particularly with frequent and thorough inspections to try and help make your decisions with antibiotic use there. Any risk to beekeepers ingesting AFB spores? Nope. However, I think there is one random case report out there where they showed that the injection of contaminated honey into the bloodstream with drug users was associated with disease, but it's a really, really rare and kind of obscure thing there. But in terms of just normal ingestion, no. Our gastrointestinal tract is not like that of a larval honeybee, and so we will not cause termination. And then our test kits available from Man Lake, a reliable test method for American foulbrood disease. So this is referring to the field side test kits that I was equating to pregnancy tests. We're looking for the development of lines there. They can certainly be useful as supportive evidence for what you're seeing, but I don't know if I would put all of my eggs into